Hello everyone. Today we'll discuss about sleep problems in children. In our OPD, most of the parents will come with their children like their baby not sleeping at all, means insomnia. And some mothers come with their newborn babies like baby is sleeping every time, not feeding at all. Then what is the normal duration of the sleep according to different ages? Let's discuss. From first 2 to 3 months, the baby will sleep for 10 to 19 hours also. And next till 1 year, the baby will sleep time decrease to 12 to 15 hours. And 1 to 2 years, that is 11 to 14 hours. And 3 to 5 years, like before school going children or nursery children, they will sleep for 10 to 13 hours. And 6 to 13 years means when the children are going for preschool, primary school, they will sleep for 9 to 11 hours. And when the age is 14 to 17 years, means high school children, they will sleep for 8 to 10 hours. And most of the mothers, parents for SSLC or PUC standard, for PUC standard students, they will force them to sleep for 6 hours. The minimum duration is 8 hours. If the sleep time is reduced, means if the child is getting insufficient sleep, then it will lead to poor health, and also the brain functions abnormality like lethargy, depression, and distress, and also like lack of concentration. So let's talk about the sleep hygiene, means safe practice of sleep in children. Like first we will discuss about safest sleep practice in newborn child. As we see in the diagram, place the baby on his or her bed to sleep at night or during nap times. Do not use pillow or comforters, and make sure baby's face and head stay uncovered and clear of blankets and other coverings. Most of the children after breastfeeding they will sleep for 1 to 2 hours. And some newborn babies, they are irritable to console and fussy. That time you should suspect the medical problems like colic pain, GERD, gastroesophageal reflux disorders, and formula intolerance. For newborn babies until 6 months, you can share the same room but not same bed. You should keep your baby in cradle. Next, we'll discuss about what are the basic principles of sleep in children. Or children, you have a set bedtime or routine bedtime. If your child going to sleep at 9 o'clock daily, means the child every day it should go at 9 o'clock for sleeping. And also the waking time also should be regular. And also during children, the sleeping time difference between school days and non-school days, it should be not more than 1 hour. And also wherever the child sleeping, the room should be quiet and also dark. If the child is afraid of dark, then you can put a dim light. And also before sleeping, means before 1 hour, avoid screening like TV, computer, and mobile. And also the 2 hours before sleeping, avoid caffeinated drinks like soda, tea, coffee, and chocolate. Avoid heavy meals before sleeping, is 1 to 2 hours. But for children, you should not send hungry children to your bed. So you can give snacks like cup of a milk you can give to your baby. You should not use the baby child room or punishment like timeout, right? Everything. Think it as your child room is for sleeping purpose. So don't put any TV, television, or computer in that room. And comfortable room temperature should be less than 24 degrees Celsius. You can maintain it by thermostat or AC. Then what are the basic principles of sleep for adolescents? Means adolescents also has like this only. Students are like that. They will sleep in the weekend days, but they should not follow like that only. And also the while school and non-school days, the difference should be less than 1 hour. And also ask the child in their room, do not smoke before 2 hours of sleeping, and also do not take alcohol before 2 hours. Do not take alcohol, and also the most of the sometimes the children used to take melatonin or sleeping tablets. So avoid all those tablets also, and also some students some children like they used to study in their sleeping room only, but it should not be. It should not. No. Thank you.